Welcome to the third episode in a series of 4 recordings giving you basic information about the NDIS for health professionals. Today we're going to be talking about planning. I'm Andrea from the Summer Foundation and this is Michelle. So in this episode we're going to cover the following topics. The first one is what happens in the planning meeting, and the second one is how do you prepare for that planning meeting.
Andrea, I think we should start by clarifying what is meant by planning. So what actually happens in a planning meeting?
Thanks, Michelle. So the planning meeting normally goes for about 60 to 90 minutes in length. It's always best to ask for a face-to-face meeting, and this might even happen in the hospital. If you're working with a patient that's unwell, you can ask for the planner to come and meet you in the hospital with that patient. It might be with an NDIA planner, or it could be with a local area coordinator. If you're working with people with really complex disability needs, it is best to ask for an NDIA planner. Participants can also choose to bring 1 or 2 people along to support them. So that might be a health or a disability advocate, or a family or friend that knows them really well. And finally, a planning meeting involves talking about the participants' goals and the supports that relate to those goals, the types of services that will help them to achieve their goals. Michelle, can you tell us about some of the ways that workers can support people to get ready for their planning meeting?
Yeah, definitely. So as a health professional, you can help support the person to nominate who they'd like to attend the meeting. So as Andrew mentioned, that could be a family or a friend or a neighbour, but it also might include one of the health staff members or a disability advocate. You should also try to document all informal and formal supports. Like formal supports might include attendance to a day centre, or informal supports will be anything that the family or friend or neighbour does to assist that person in terms of their daily life. You then should identify what the gaps are in their current supports in terms of what they're going to need in the future. And then you would need to identify what a person's short, medium and long-term goals are and the broad steps required to achieve these. You then want to match the NDIS funded supports with these goals. To do this, it is recommended that you use a pre-planning tool, and this is something that many health services have come up with their own model of, and it's a way of recording all of the supports that the team and the person is wanting through the NDIS and pulling it all into one clear and concise document to ensure that nothing is missed. As health professionals, you should also collect all supporting documentation, including things like a participant and carer statement, which outlines perhaps from their perspectives what a typical day looks like and what support they would need during that day. You should also evidence with the NDIA reasonable and necessary criteria any supports that you're recommending and provide quotes for any assistive technology. And when we're talking about funded supports, it's important to understand the types of supports that are available to people and how they are grouped together. So there are 3 major types of supports within an NDIS plan. The first is core, and that includes assistance with daily life, such as personal care, shopping or home help, etc. There's also transport, so getting out and about in the community. Consumables, so an example of that might be continence aids if required. And then assistance with accessing the community to get involved with social activities. The second type of supports is capacity building. So that includes coordination of supports and building a person's capacity to help manage their own plan. And that's usually provided through a support coordinator. There's also improved living arrangements, increased social and community participation, being able to find and keep a job, maintaining and improving relationships, health and well-being, learning opportunities, life choices, and daily living. The The final type of support is capital, and this includes all the big ticket items such as assistive technology and home modifications.
So my foundation also have a number of sample plans. So these sample plans are for demonstration purposes really, to show you the way a plan is put together, what the goals look like, and then how the supports that have been funded relate back to those goals. There are a number of different scenarios that we've covered for these sample plans. So for example, one plan relates to a person living in residential aged care who's keen to move out. Another sample plan is related to a person living in specialist disability accommodation or SDA in the community. These are just a couple of the scenarios that are covered in these sample plans. You can find these plans on our website, and there's a link on your screen now.
So what are some of the key things to remember for workers when they're assisting people through the planning process, Andrea?
Thanks, Michelle. So aside from assisting people in the ways that we've already mentioned, there are a couple of other things that can be quite helpful for you as health clinicians. Firstly, if you've done a pre-planning tool or document, send that through to the NDIA prior to the meeting. That will give the NDIA planner or the local area coordinator an opportunity to go through that plan and prepare for the meeting when you see them face to face. Secondly, ensure all of the elements of the plan are discussed during that planning meeting. So for example, if you've advocated for support coordination, make sure that you actually bring that up in the planning meeting, which will ensure that it is included in that person's plan. And finally, ask for the planner's contact details and any time frames for next steps. So you've got somebody to go back to and you've got some clarity on how long the next steps are going to take.
So to recap, we've talked in this episode about what to expect from the planning phase of the NDIS journey. Remember to ask for a face-to-face meeting. Encourage the person to bring some supports along, and prepare important supporting evidence to ensure the participant gets the best possible outcome. Coming up next, Zoe and Andrea will talk about implementation.